Okay. All right. So it's time to record. Okay, here's what we got to know about sex hormone testing. So this is testosterone, estradiol, progesterone, LH, and FSH. So these are super important because they have a role in mood, energy, libido, motivation, sleep, cognitive function. Like oftentimes, if there's errors that are happening in these regards, hormones are involved. And it's something that we don't talk about often in our field, like we might just medicate the top of it, but then testing for a lot of the underlying stuff can really make a huge difference. For example, women who have menstrual changes and men who have low testosterone. So we want to be able to assess for testosterone, estradiol, progesterone, luteinizing hormone, follicle stimulating hormone, sex hormone binding globulin, and some of these ones too: prolactin, DHEA, which we talked about, androstenedione, and anti-Müllerian hormone. But definitely some of these big ones. Yeah, pretty much I'm just recording lectures for my program right now. And I'm trying to pull up a good diagram that will explain it all. Yes, here we go. Okay, so if we look here, we have the hypothalamus. The hypothalamus makes gonadotropin-releasing hormone. Then we get to the pituitary, which releases LH and FSH. And so that goes to the testes to make testosterone, and it goes to the ovaries to make estrogen and progesterone. So when we assess the hormonal levels, then we can see at which stage of the pathway that there is an error in. So, and then, I'll go through all of these as well. So, testosterone. So, the function of testosterone to help motivation, libido, assertiveness, focus, and energy. So, this is definitely becoming more into focus over the last 5 years. A lot of people are really becoming aware of this. So, enhances dopamine and reward pathways. I've heard people say that it makes hard work feel good, it makes effort feel good, it makes you feel energized and strong. And something women need this too, it's not just men. And deficiency can contribute to depression, low libido, apathy, brain fog, and fatigue. So it's definitely a low-hanging fruit to test, and you can have a lot of yield from it. So for guys, the normal range is about 300 to 1,000, and the functional range tends to be greater than 500. So that's where I like to shoot for at least. Obviously, so this is a broad range, so there's a couple problems with this, especially if you're assessing in men. So one is that this is not age specific. So a 21-year-old guy might come in with a testosterone of 300 and get classified as normal, but that may not be normal for him, because the 75-year-old guy might have the same level of testosterone too. So you have to adjust relatively based on the age. And second, remember that this is just a number. It's more about the functioning. So someone could be at 350 and doing great, whereas I had a patient who had severe OCD, and his testosterone was the highest I've ever seen. It was like 950, and the dude was eating just a paleo diet. So obviously you have to correlate it clinically, but you do want a healthy amount of testosterone if the patient is having any of these type of symptoms. So then there's free testosterone, so 5 to 21, that's the goal, with goal to be greater than 12. This is testosterone that's not bound to the hormone binding globulin. And then for women, the level 15 to 70 as well, so you just want to check that. So yeah, depression, irritability, and anhedonia. So for women, fatigue, low libido, and low motivation. I remember hearing this anecdote about a female bodybuilder who got on testosterone, and she said, wow, like, I don't understand how guys do it, because I have never felt, I feel like my libido super high all the time. And so just to be aware, it's important. But if you have too high, of course, like in PCOS, you can have irritability, acne, anxiety, and mood lability too. Then we have estrogen, estradiol. So this is helpful for mood, cognition, and sleep. It helps regulate a lot of hormonal systems. Like, it's a very complex hormone, of course, for the menstrual cycle regulation, reproductive health, and for guys too, it helps balance out testosterone because they work antagonistically. So if a guy, for example, has too much estrogen, they might have too low testosterone. And in fact, there's a lot of talk in the men's space about eating soy products and estrogenation and guys losing sex drive because there's estrogens in the water, there's birth controls in the water. But that's a different topic. So for obviously it will peak in with the cycle. Perfect. Okay. So remember that it shifts. So with estrogen, right, 2 days or 2 weeks before the cycle, it starts increasing, and then it will drop at the ovulation point, and then drop significantly, and then slowly come up from there. Progesterone, we know that increases in the luteal phase. Or sorry, hold on. Yeah, so progesterone will increase during the luteal phase, or estrogen will increase after menstruation, as the lining is shedding, but before ovulation. Yeah, and then you have the LH and LH spike, and then FHA spike. So basically, the point is that when you're measuring these hormones, you got to know what point of the cycle they're at, so that way you can track relativeness. So for estrogen, if they are premenopausal, then 25 to 75 on day 3 of their cycle. At the peak of the ovulations, 200 to 400. Postmenopausal, it becomes less than 20, and then men 10 to 40. Right. So if we just look here, right, premenopausal, or sorry, like pre-ovulation versus ovulation peak. So low estradiol, so women, you'll have depression, brain fog, sleep issues. High estradiol, you may have mood swings, irritability, PMS. And so guys who have elevated estradiol and testosterone may feel fatigued, emotional, and depressed too. So hormones, very, very important for both. Then we have progesterone. So progesterone is calming, anxiolytic through GABA, balances the excitatory effects of estrogen, so that's really important. And so promotes sleep, mood stability, and emotional resilience too. So in the luteal phase, so that's when it peaks, so about 5 to 20 nanograms. So see, in the luteal phase, that's when the progesterone is peaking. Then you have the follicular phase, which is not that much, and then the postmenopausal phase, which is not that much either. And so you see that it's a lot less over here. So psych relevance, so low progesterone in the luteal phase, that's what leads to PMS, PMDD, irritability, anxiety, insomnia. So they feel that's why it often happens 2 weeks before their period. So they feel normal after ovulation, then they become unstable before the menses. So this is the time that the PMS really predominates, is the luteal phase. And so, progesterone, so that's something that has been used, that an endocrinologist or possibly an OB-GYN would use to relieve mood symptoms in perimenopausal and postpartum women. So then we have luteinizing hormone and follicle stimulating hormone. So this helps to control ovulation and the sex hormone production. So remember, like, this is what stimulates from the pituitary. And so for women, it's used as for menopause, PCOS, ovulatory dysfunction, just to check if it's more upstream. And then for men, to regulate their testosterone synthesis. So For women, during the follicular phase of the cycle should be 3 to 10, and then the postmenopausal phase it becomes greater than 30, because remember, since the ovaries are gone postmenopause, then the FSH increases to try to stimulate them. And then LH, so follicular phase 2 to 15, and then the luteinizing hormones, so 2 to 200 to stimulate the estrogen. So this is what causes the estrogen surge. And then for men to LH and FSH, so this is a wide range that they have. So remember, if you have high FSH to low LH, so that indicates menopause or ovarian insufficiency, because it's trying to stimulate the follicle of the ovarian and of the ovary. And the if you have low LH and low FSH, then you have low testosterone there. So that's what leads to pituitary dysfunction, or that can be a sign of it, because that means there's a pituitary problem that's happening. And then if there's PCOS, then you have an elevated LH to FSH ratio due to all of that estrogen stimulation. So, the LH is increased, which is causing the ovary to produce more estrogen, and so it's leading to irregular cycles and mood dysregulation. So then you have sex hormone binding globulin. So this binds to testosterone and estradiol. It helps to regulate the free hormone availability. So if you have a high amount of this, that means you have less free testosterone. And so this is influenced by estrogen, liver health, thyroid, and insulin resistance. So super key to know this. So psych-wise, right? So if you have high sex hormone binding globulin, so that could hide some of the low free testosterone and fatigue and apathy. And if you have low, that's been seen in insulin resistance and also in PCOS. So there's too much now hormones getting unchecked. So overall, really important to check the hormones. This is like a standard panel that I will order for people. So always interpret them with their symptoms, age, and menstrual phase, of course. Ideally, if you can, test women on days 3 and 21. I know in real life it's harder, but you try your best. At least have them record the day that they come in so you can track relatively. Perimenopausal can trigger mood lability. So PCOS, something we don't really talk about as much. So if they have irritability, acne, irregular periods, or DHA and testosterone, definitely look at that. So hormone imbalances, you can help out a patient a lot by reducing their need for medication from this. And consider hormone therapy, because that could help the patient not need an SSRI, for example. And nutrient support too. And then this is talked about more in the supplement module, but nutrient support can help replenish hormones. So for example, there's a lot of zinc is really helpful for testosterone production, and eating a higher fat diet is really helpful to help these hormones, because they are made from steroids, are made from fats. So overall, hormones important. Is zinc the best component for optimal testosterone? Yeah, zinc is really good. I used to take a lot of zinc when I had low testosterone. That's why red meat is so helpful for testosterone as well. BRB, I'm going to get some socks because the AC is kind of cold. Okay, excellent. So now we just did that. So now we're going to talk about ANA. Yeah, ANA is an important one too. It's not one that gets discussed much in psych, but it has its uses. Okay, here's what we got to know about ANA and autoimmune markers. So ANA, okay, here's what we got to know about ANA and autoimmune markers. So autoimmune markers, they can help identify if there's any kind of immune activation or specific autoimmune diseases that can have psych symptoms like fatigue, anxiety, cognitive fog, depression, or mood lability. So, when you have a treatment-resistant case, a neuropsych symptom, let me just redo that again. Okay, so here's what we got to know about ANA and autoimmune markers. So these are important because they can help identify systemic immune activation or specific autoimmune diseases that can have psych symptoms like fatigue, anxiety, cognitive fog, depression, or mood instability. So these are important for treatment-resistant cases, neuropsych symptoms with no clear cause, or if there's any kind of suspicion of inflammation or autoimmune encephalopathy. For example, like the patient, they have an autoimmune history, they might have rheumatoid, they might have Sjogren's, they might have Hashimoto's, they have a high CRP, so like that makes me suspicious. So this stands for anti-nuclear antibody, and so it's just all it tests for is autoantibodies that target components of the cell nucleus. Like it's a very general one, so it's a very general test. But then if there's antibodies to the cell nucleus, then you're like, okay, now let's dig deeper. What kind of antibodies are they? So are they lupus, Sjogren's, autoimmune, etc.? So it's used as a screening test. Basically, it tells us, okay, we should go further on this. And then if it's positive and the patient has clinical symptoms, then you go for more specific antibody panels. So normal ranges, so obviously none, negative, positive. There's a titer that you look at, like 1/80, 1/160, 1/320, and if you have a higher titers and like there's specific patterns, sometimes like the lab report might say homogeneous or speckled or nucleolar, that suggests some autoimmune activity. And just remember that the titer, so basically this is dilution, so how much it gets diluted and still detectable. So this means that it was diluted like way more than this one, and so it was diluted at this amount and it's still being detected, so that's a high likelihood of an autoimmune condition. And this just represents how it stains in the lab, like what part of the nucleus, or like in this case the nucleolus, it stains. So if you have a positive ANA with a high titer, like 1/160, so that tells us, okay, there's probably an autoimmune process going on. If it's low, you just have to go through it clinically. Like plenty of patients might have sub threshold Like plain normal people might have this, and then this could be like a sub-threshold thing. So it could be incidental too, right? Some people, remember, it's all a spectrum, it's all a gradient, and then we just decide, okay, X amount of dysfunction, it becomes a disease, and then less than that, it's not a disease. So if it's negative, it doesn't rule out all the autoimmune diseases either. It's just a strong screening tool. Your clinical judgment is what ultimately will come into play. But if it's positive, then you can go with, different panels and see where, depending on the patient. So double-stranded DNA, for example. So this is specific for lupus. So, elevated levels can have disease activity, including neuropsych lupus. And so you order it after positive ANA. So I remember I had this one patient. For her, she had some of these symptoms, the depression, anxiety. But then she told me about this rash she would have, and she described it like a sun-sensitive rash. I think it was like a circular thing, and that just triggered a thing for med school. They call it a discoid rash, and I was like, huh. So I tested her for lupus, and lo and behold, she was positive. Referred her to a rheumatologist. Then you can have an ENA panel, so extractable nuclear antigens. So these are more specific for specific autoimmune conditions like systemic sclerosis, polymyositis, mixed connective tissue disease. Obviously, the patient should be having symptoms of all of these too, to make you test this, or you might not even test this. Like this is something that a rheumatologist would do, but I remember that let's say they don't have a rheumatologist, or you want to refer them, and you have suspicion they might have one of these, then you could still order the lab panel while you refer them to the rheumatologist. So important to note is that the Sjogren's antibodies, so they can cross the placenta, so just to be aware in pregnant patients, and then autoimmune stuff, so that can cause chronic fatigue and mood symptoms. And they may also test positive as well too. So, and then you also have CRP and ESR. So C, reactive protein, acute phase protein, so it rises for systemic inflammation. And then ESR is more of a chronic inflammation thing, but basically these are inflammatory markers, so these can cue you to say that, hey, okay, maybe I should be testing for ANA and stuff. So, if I see this and the patient's having chronic symptoms, it makes me think, okay, is there an autoimmune process happening? And these are the values for that. And then, so CRP and ESR, so it's seen in depression, bipolar, psychosis, and OCD. So if a patient has treatment-resistant depression, or quite frankly, any other treatment-resistant condition, that's when I'll implement anti-inflammatory strategies to further augment their treatment. Then we have thyroid antibodies, so TPO and thyroglobulin, so they can detect autoimmune thyroid disease, Hashimoto's, Gray. This is the most common autoantibody, usually by far. And so, you can still have positive TPO antibodies, right? So even if the TSH is normal, they could still be positive antibodies, meaning that there's still anti-immune action that's going on at a more subtherapeutic level, or if there's some immune dysregulation happening. And so the Hashimoto's thyroiditis that can cause brain fog, anxiety, mood swings, even psychosis, and it's more common with women, peripartum, and autoimmune prone patients as well too. So when to consider autoimmune testing in psych, so it's if a patient is having new onset psych symptoms in a child or young adult, if they have fatigue, brain fog, or depression that's unresponsive, if they have mood swings with migraines, rashes, or joint pain, like these are rashes and joint pain are classic non-specific symptoms. Post-viral symptom onset, like after COVID or EBV, so that can happen as well too. Like there can be autoimmune stuff that comes after a viral illness. Family or personal history, this is a big one for me. If I hear that, then it makes me way more suspicious. And then any kind of rapid cognitive decline or neuropsych symptoms. So you definitely want to refer to rheumatology if these come back positive. If you need to do any further type of testing, and this would be more like an inpatient setting if you're concerned for autoimmune encephalitis or neuroinflammation. But it is worth noting, these are more the rare antibodies like anti-NMDA, GAD65, or VGKC. So these are more complex neural receptor antibodies. So if you have autoimmune psychosis, so this would definitely be like a complex inpatient type of picture. And then also checking for vitamin D, B12, and cortisol. So overall, autoimmune disease can mimic psychiatric illness all the time. ANA is a screening test, and then you have to follow it up with specific antibodies and the history. Even a low titer positive ANA could be a preclinical autoimmune state. If you have a young female, most common audience for mood swings, fatigue, or mixed symptoms, consider that. Inflammation can explain treatment-resistant cases, and then thyroid antibodies are common even with normal TSH. So you want to check mood stability, fatigue, and postpartum changes as well. So this is like more of a fringe test. It's not something that I would order. I wouldn't order ANA on every patient, but if I have suspicion, then I will order it. Happy 4th to you too. Yeah, exactly. Alright, so I think I'm gonna go eat. So maybe it's time to go eat. So why don't we do that? I'm getting pretty hungry. All right, so let's do this. So yeah, hopefully things have been good. I know, even if happy 4th of July. Yeah, even if things have been, no matter what the holiday, some things will always stay the same. Some things will never change, right? So, yeah. Good to see you. Good to see you. Yeah, okay. So at least I'm now more available. So yeah, ask me. Now's the time to ask our questions here. Let's get. Oh yeah, and double tap this if you like this. Let's see if we can get to 4K likes. Oh, let me get the yeah. So salmon, yeah. Very American of me, right? Ooh. Actually, so womp womp, we actually ran out of broccoli, so we don't have that anymore. All we got is all we have is the chicken or the protein. So that's what we're gonna have to go with. I mean, you gotta do what we gotta do, right? So yeah, let's see what we got. Grub it up. Yeah, so I was basically recording lectures for my NP program, so that's what I was doing before. So I'm introducing a new module for lab testing and how to do good labs and how to interpret really good labs. Because I think it's something that's not done as often as we should do it in psychiatry, and so good lab work can make such a difference in the patient's life. Because my view is that if you can treat a lot of the underlying causes, then you don't really need to then the patient may not need nearly as much medication or any other kind of treatment. So that's what's important. Don't forget to wash your hands. Oh, yeah, I usually wash my hands after. Whatever. Like, see? Now I'm going to be touching the other thing, so that's when I'm going to wash my hands. Like, since I'm going to touch the spices. Okay, awesome. You just touched phone, salmon, oh, rip. Well, I guess we're going to hell. I guess we're dying. I guess we are dying then. That happens. Hopefully the heat will curb it. Isn't that the whole point of cooking? Is to get rid of toxins and burn them? Have you ever diagnosed a malignant narcissist? I don't even know what that means, honestly. These are such buzzwords nowadays. Like narcissist, gaslighting, like they're just thrown around everywhere. Like, my psych just told me to stop fluoxetine after taking it for 6 months, weight gain. I mean, yeah, you can fluoxetine's like the one med that you can come off really easily without issues. It's the one psych, like long-term med, you can come off without issues. Weight gain is not that common in with fluoxetine. It tends to be one of the least likely. Of course, it can happen. So that's where I would say modulate your diet. Make sure your diet's really good, right? So like kind of what I'm doing. You know, even on America Day, right? This is the day-to-day that we're going with. What is that for? So this is lemon pepper that we're doing. Yeah, so this is what we're doing. So no need to taper down. Yeah, you don't really need to. Thoughts on B vitamins for ADHD therapy? Really important, because then with ADHD therapy, the B vitamins will help with dopamine production. But something I think is also important is eating a low carb diet, because blood sugar will spike up. People's high blood sugar will spike people's impulsivity up and down. Their moods can go up and down, and their focus can go up and down. So when you eat low carb diet, your blood sugar gets a lot more stabilized. So for ADHD kids, for example, don't give them cereal for breakfast. Like, give them protein, give them eggs. I had salmon for dinner. Welcome, join the squad. What advice do you have for FNP with the private practice? Now completing my PMHNP in 7 weeks. Yeah, so my number one advice is make sure you get good mentorship, because you don't want to be you're going to be entering a place where you're probably going to be doing a lot of work, and you probably won't have a lot of time for learning and mentorship. A lot of mentors are kind of crappy in the field nowadays, and they pretty much just take your money, or the job's function is to extract as much labor out of you to increase your revenue, right? Always remember that that's your role in a company, is to provide labor for them, so that way the enterprise can be profitable. Whether it's a hospital, whether it's a clinic, whatever it is. So they're not really investing in teaching in you. So you have to invest in teaching yourself, because that's the only way you're going to keep on learning. Like I've done residency and fellowship. That was for 5 years, and I still am learning new stuff every day. So if I'm learning new stuff, then if you're new too, you're definitely going to be learning new stuff. So that's the most important thing, right? And never have the arrogance to feel like, oh, you know it all, because even I don't know everything, and I'm still learning. So yeah. And then, so if you want to learn from me, for example, you can look at joining our coaching program, because we have over 150 NPs in the program, and they all join for the same reason, because they really want to learn in-depth psychiatry. That is the goal. And yes, I think the salmon is going to be so good as well. You know, I let it thaw out for 2 days now instead of 1, and I definitely am noticing a difference. So I think I'm gonna do that much more frequently. It's good doing the long thaw. Doctor, have you ever said if you have ever had any mental I don't really have any mental health diagnosis myself, no. I mean, I take care of, I just came back from the gym this morning. I slept about 8 hours. I mean, you can literally see what I'm eating. I don't have any veggies today, unfortunately. I ran out. But, taking care of those basic things helps a lot. I think something else that helps me is that every time I have a negative thought about myself, I'll say, no, stop it. Like, what is the positive thought I can replace that with instead? Like, every time I have it, I will never, ever talk bad to myself, because it's like feeding yourself poison. So, like, why would you ever do it? So those 4 would be the number 4 tips I would give for mental health benefits. Add a fresh lemon. I don't have a lemon. So we have to, nice, working on that habit. Yes. And so see, this is key. It is a habit. Talking bad to yourself is a habit. So you have to replace it with a good habit. So it's a habit. Remember that. So it's not like you're stuck like it. It's a lifestyle. Just like going to the gym is a lifestyle, just like sleeping well is a lifestyle, etc., etc. They're all lifestyles. So also, if you're liking this, definitely double tap. Let's see if we can get to 5K likes here. 5K likes for America for the 4th of July. Let's see if we can get to 5K. We're on 2.3 right now, so all you have to do is double tap, and then let's see if we can get there. And then that way it'll share it to more people too. I'm not Jewish, so I'm not sure where you got that from. Oh, rip. I just remembered we're trying something new. We're trying to cover it now. So by covering it, that will help it'll help all the moisture stay in. So that's it. How to do intermittent fasting. So that's what I do. So I eat generally about 1 meal a day, but normally I would eat, like back in the day, my normal intermittent fasting is 2. So I would eat a meal around 1 p.m. Then I would work out in the afternoon, and then I'd eat a meal around 6, and then be done. And then in between is when I would eat a lot of water and stuff. Like water, I use sparkling water a lot. Sparkling water is really good. Yeah, sparkling water is really good as well for intermittent fasting because it helps. It just helps keep you full. Yeah, let's see if we can get to 5K right now. Ooh, we're at 4.2. How do you work out at 1 with your job? This was back when I was in med school, but now I don't have a job. I'm fully self-employed. Do social media stuff. I schedule all my clients when I want to. So yeah, exactly. So just different. If you make a parcel in the foil with some butter, yeah, but do we need the butter calories? That's the question. I've had a manic episode where it lasted a few weeks due to Adderall. Why my doctor diagnosed me? I'm not sure. You should definitely talk to them. Right. Hard eyes. Hey, good to see you. Why do you say clients, not patients? I say both. Sometimes clients, sometimes patients. Since I have more of a private practice and it's more personalized, I think it's more like a high touch. Like I do a lot more for my patients than like the average doc does because I have less patients. So I do a lot of integrative testing, a lot of gut health testing, a lot of supplements. So it's a more specialized I answer messages whenever. So it's more of a specialized service, and that's why I consider them clients as well too, because my goal is to help them. And plus a lot of people don't like that patient identity. Like they like being like, I'm a client of his. So yeah, can you tell me about somatic symptom disorder? Yeah, so somatic symptom disorder, pretty much what that is like you have what's called somatic symptoms, like gut pain and maybe like neck pain, nausea, that type of thing. But there's no biological cause to it. But like you're constantly just feeling like you have these symptoms. How many doctor's appointments does it take for diagnosis? Depends on what you're trying to diagnose. Sometimes one, sometimes a couple. They told us to use client as it's more empowering. Not sure I agree though. Yeah, it just depends. You may ultimately that the reason it's called the practice is because you have your own practice. Like you make your own rules and you make your own way that you want to do it. So that's what I teach my students too. Like I'm not just trying to teach them like this is how you do it, but I say like, okay, this is how, for example, I treat depression. This is how I treat anxiety. This is how I approach X or Y patient because that's how my practice works. And so then you get to decide how you want your practice to be. Like that's the most ultimate thing. Hey man, I started in January. Any study tips to get ahead before my program? Yeah, make sure that you get into good mentorship. That's the most important thing because a lot of the programs will not teach you very well. They won't teach you good psychiatric skill. They'll just teach you like admin stuff and policy and things, but they won't teach you actual psychiatry so that, you get to the patient and you're like, I don't know what to do. So you want to make sure that you find good mentorship and find good mentors to learn actual psychiatry from. That's the most important thing. Can you have PTSD without dreams? Certainly. Nice. We're at 5K. Let's go. Let's see if we can get to 7K. Definitely double tap if you're finding this helpful, finding this valuable. How do you treat sleep paralysis? So I'm not a sleep paralysis expert by any means. So a sleep doctor would see that. But I think you would use medications to limit REM sleep, like clonazepam, for example. But sleep paralysis is not something I would have treated. Can you have PTSD without dreams? Yeah. Basically in PTSD, you need what are called intrusive symptoms. And so intrusive symptoms can be flashbacks and recurrent thoughts of something over and over. You don't necessarily need to have nightmares. Do you know if Buspar has memory loss issues? I mean, it's possible, but it's rare, it's unheard of. Buspar tends to be pretty innocuous. Like, most people tend to respond to Buspar really, really well. So it's not something that I tend to stress a lot about. Your take on ECT for psychosis, for rare stuff. Prednisone and huge mood boost, what's up with that? Probably increased energy from cortisol. Or it could be suppressing your, if you had a lot of inflammation. Prednisone is a steroid, it suppresses inflammation, so that could help mood boost as well. Okay, I'm gonna set up my light. So, BRB, let me set this up. Meanwhile, just think about what you want to ask. Definitely like this as well too, so that way when you like it and you share it, more and more people can see it and get access, and then they can benefit from the learning as well, from the mental gains. Because remember, life is all about trying to improve and making gains. So we're trying to make physical gains, of course, in the gym, and then you want to make mental gains as well. So that is the goal, both physical and mental gain. Oh, I forgot to turn it on. Yeah, both physical and mental gains. That's the goal. All right, we got 5 points. Let's see if we can get to 7K likes. Definitely double tap this if you're finding it valuable. Just give it a double tap. Let's see if we can get to 7K. Okay, I don't understand what you were saying, brother. I'm thankful for my psychiatrist. Nice. I'm nervous about seeing a psychiatrist. Yeah, I mean, like, if the GP is just for like level 1 treatment, but like once you get above that, like, you should see a specialist. Like, imagine like seeing your GP for your cancer treatment. How do you determine between schizophrenia and synesthesia? I'm not sure what synesthesia is, but schizophrenia is very diagnosed. It's a very like diagnosed condition. It's got hallucinations and delusions and break from reality, that stuff. What are your thoughts on Wellbutrin? So Wellbutrin is it's a great medication. It can cause, or it helps treat ADHD, helps treat anxiety. So both of those are win-wins. Alex MD, I don't really understand what you're saying. What's your opinion on being antidepressants for 10 years? It's a risk and benefit, that's all. So, you can try to come off. If you do, great, but if you don't, then it probably means you still need them, right? Because you have to try to treat whatever's underlying happening too, and they can really help people function. What do you do with non-compliant patients? I mean, nothing. I'll try to do motivational interviewing, see why they're non-compliant. But I'm a big believer in autonomy, and so this is something I teach my students as well in our coaching program. Is that, like, for me, patient autonomy is everything. So if the patient doesn't want to do it and they have the decision-making capacity to decide that, then I leave it to them. Like, I don't stress if the patient doesn't or doesn't want to, because ultimately every patient is responsible for their own treatment and how invested they are. I had a mentor once tell me that never invest harder than the patient. And that really stood out for me, because I had the story where I was just starting as a new resident inpatient, and there's this guy who was a big substance user who came in, and when I was working with him, I got him all these discharge resources. I was like, okay, we're going to do this. We're going to change your medication. I'm going to get you this long-acting injectable for to help with the addiction, and I'm going to connect you to social working and all that. And he's like, yeah. Fast forward a month, and my attending's just laughing. And then fast forward a month later, he comes back, and I was like, the patient comes back, and I was like, what happened? And he, like, lo and behold, he didn't do any of it. So and then I talked to my attending about it, and he's like, yeah, that's a lesson I learned. Never work harder than the patient. And so unless they want it. So that really stood out with me. So if you're a provider listening to this, definitely take that to heart. It's kind of like, imagine if the gym, or you're a personal trainer, and you're trying to encourage the patient or the client to show up to the gym, to do their workouts, to track their calories, to work out even when you're not there, and they just don't do it. So it's like, you can't try harder than they can. So, and ultimately people make their own choices, and they have the right to make their own choices. But because they make their own choices, they also have the right to the consequences of those choices too, whether good or bad. What's the best SSRI for OCD? Probably Luvox. That's the one that has some exposure to it. A little bit of extract, most FDA. It's got a little bit of special activity for it as well. How do you feel about Depakote over Keppra for seizures? Probably Kepra's more safer for seizures, but Depakote also has some mood stabilizing benefits. So that's why we would, if a patient has mood issues and seizure issues, then they'll go with Depakote for that reason. I've been having bad side effects for clonidine. What else do you suggest for sleep? Maybe decreasing the dose. Trazodone, hydroxyzine, a lot of stuff. I've been having bad, magnesium. Magnesium is really good too. All right, so let's see. Awesome. We're at 65K likes. Let's see if we can get to 70K or 7K likes. We're at 6,500. Let's see if we can get to 7,000. So just double tap the screen. Thank you, DJ Soil. Thank you, question mark. Thank you, Bobby. Thank you, Madre. Awesome. We are ramping up. We're ramping up. Is Vyvanse okay for long-term use? Not ideally, but sometimes people who have severe ADHD really do need it. Is hydroxyzine okay? It's not the best when you're older, but when you're young, it's fine. As long as it's not making you too sedated or anything. Nice, we're at 7.1. Awesome. Let's see if we can get to 8K here. 8K. Do you use UpToDate? Yeah. Yes, I do. Not as much anymore, but when I was training, I used it a lot. Remember, the UpToDate is just written by other doctors, too. It's not like it's like a magical thing. Is high-functioning schizoaffective a disability? It's a disability if you want it to be a disability. Xanax or Ativan for anxiety? Probably Xanax. Works a little bit better. It works a little bit quicker. Ativan, I think, is a little bit more sedating. Is cardiophobia a real thing? I've had a couple patients say that. I had this one patient who was afraid of his heart rate a lot. Doxepin for sleep. Yeah, Doxepin's a good choice for sleep. It's more of a sleep maintenance. It helps with falling asleep, but it really helps with staying asleep. Like, that's what it's really used for. So that's like the unique advantage of it. So yeah. Okay, awesome. We're at 8,500K. That's awesome. So yeah, okay, let's see what our breakdown here. Type in 1 if you're a provider, and type 2 if you are a patient. And then just 3 if you're like a, just like regular person watching this. I'm curious what the distribution is. 1, if you're 1, and then say what kind you are too. Hey Robin, good to see you again. Mauricia Hales. Okay, 1. Yeah, happy 4th. 1, PMHNP. Nice. Ones. 1. User 517. Sunflower, welcome. Naturally Cute 04, welcome. Hannah Russell, provider, youth and family therapist. Okay, welcome. Okay, looks like we got a good mix here. Can GERD worsen anxiety? Yeah, definitely. Oftentimes, you have GERD, a lot of that reflux, it can come up and then cause chest sensations and stuff. People can perceive it as panic attacks. So yeah. Where the broccoli at today? Yeah, unfortunately we ran out, so it's more of a protein kind of day. 3, nice. Do mast cells increase anxiety? Yeah, I'm a big believer that eye inflammation causes anxiety and depression. So which antidepressant med is the best for least sweating side effect? Something that's less norepinephrine. This happened to one of my patients recently. He had on 60 milligrams of duloxetine, so we had to reduce him to 40 because of the sweating. Because remember, norepinephrine. So if you're a provider, this will be helpful. So serotonergic medications can definitely help. Can definitely cause the sweating as well. Like for example, sertraline is notorious for it, but norepinephrine is also really helpful, or really sweating inducing. Because think about it, if you're running away from a bear, it's like your fight or flight response is kicking in, and so you're getting overheated, and so you want to be able to calm down. So that's norepinephrine kicking in, and so because of that, meds like duloxetine and Effexor can cause sweating as well too. So just something to be aware of. So yeah. Chloroform 97, amazing, nice. All right, what are your what are your 4th of July plans? What are you planning today? Are you going out or are you chilling? Yeah, what are you doing? Affects your sweaty gal here. Yeah, exactly. Drinking, relaxing, yeah. Kind of a mix. Okay, so nice. So it's been cooking in there. So I'm gonna give it a little, like 1 or 2 minutes, and then I'll take it out. Drinking and Xanax. That's not a good combination. I wouldn't mix drinking and Xanax together. It's not ideal because both of those will hit GABA receptors, and so they can interfere with each other. Okay, so now let's see if we can get to 10K likes. We're at 9.2. Let's see if we can get to 10K. Also, yeah, so if we have some PMHNPs here as well, something I was working on earlier was I was doing so I was recording lectures for our coaching program. So I'm recording a whole module on different lab orders. So, I mean, obviously the basics like CBC, CMP, but I'm recording now specific stuff like hormonal testing. I'm recording functional medicine testing things. I just recorded a lecture on ANA. I'm going to be doing autoimmune lectures, some infectious testing as well too. So I'm recording all those lectures so that way you can learn how to practice integratively too. Because if you're a PMHNP, for example, a lot of patients nowadays they want integrative care, like they just don't want med management anymore. So you have to learn how to be able to practice intermittently, not just with med management, but also with therapy or with like supplements and holistic type of care as well, so you can offer the best care to your patients. So if that interests you, right, if you really want to learn integrative functional type of psychiatry, yeah, definitely check out our coaching program too. That's the thing that I'm developing for our students. How to set up an appointment. So basically, if you go to my bio, there's a mental health quiz you can take. So just take the mental health quiz and you're good, and then it'll direct you towards it. Is it okay to take patients to take ibuprofen while on lithium? It's not ideal. Basically, what happens is that lithium will interact with it's metabolized by the kidney, and so ibuprofen is also metabolized by the kidney, so they can conflict with each other. And basically, if lithium causes any kidney damage or kidney worsening or increase of creatinine, it can increase ibuprofen concentration. And if ibuprofen causes any kind of creatinine worsening or kidney slowdown or kidney work, then it can increase lithium concentration. So that's what the difference can be. That's the difference here. All right, let's get this food out. All right. We are going to test exactly how it came out. This time I've let it thaw out for 2 days, so it's been a little bit longer than normal. So I'm curious what's going to happen. Is it safe to have one beer with less? I mean, yeah, it's not going to be too damaging, but you just want to be cognizant. You don't want to be doing a lot for both of them. Okay. Today is pretty much like it's a carnivore diet. Is there a huge difference between learning through videos and books? Yeah, I think videos are better because then you get to interact with. It's almost like you're talking to the person, and you get to understand a lot of the subtle stuff that the person teaches. Books is just text. So, yeah. So that's what. Well, in my program, for my NP coaching program, we have both videos and handouts. So that way, if you like learning through text, you can learn through text. And if you like learning through videos, you can learn through videos. So either or works. What days and time are you meeting once a week in your program? So we meet every day on Mondays. Mondays at 8 p.m. Eastern Standard Time. Uh, yeah, but every on other days we have different calls and Q&As too. So, for example, on Tuesdays we have lectures. So we'll have different companies who come in and give lectures. For example, we had Caplita talk to us. We're gonna have Spravato, Esketamine talk to us tomorrow or on Tuesday as well. So there's a lot of content there, and of course, all the recorded modules, they're available for you whenever you want to. So whenever you want to access them and review them. So like, let's say you have a patient who's on Vraylar, for example, and you're like, okay, how do I dose Vraylar? What makes Vraylar different? Or you're trying to decide which antipsychotic do I choose? So you can look at the different ones and you can see all my modules on them and then decide, okay, or if you're trying to figure out, okay, how do I taper a patient off this med? Then you can go to that med and you see how I recommend tapering off it. Wow, that came out really good. Yeah, so all my information, so you can either just send me a message and I can send you the stuff, or it's in the program. So either or. But like that's what you'll get. Like you'll get access to the community where you can talk with other PMHNPs, get job opportunities, collaborators. Some of our students have found new jobs from each other, so you can get that. You get access to pretty much all the different psych diagnoses, like me teaching about depression, anxiety, catatonia, bipolar, how to treat them, how to diagnose them properly, all the treatments, all the different medications out of there, all the different lab works that you can do to order and why you would order X or Y lab, case reports, and then weekly Q&As where you can ask me questions and actually be able to get help with your actual cases. Yeah, because it's important that, right? Like you can only learn so much from a textbook. The way you really learn psychiatry is by asking for feedback on cases and getting like expert level feedback, right? Just like when I was in residency, I would be like, okay, I think I should start Zoloft for the patient. And my attending would be like, no, because it might, or he'd be like, yes, this is good, but no, because of this, for this reason. Or if I'm like, hey, I think I should do this, they're like, no, because of that. So by getting that correction, that's how you really learn. Like you don't learn just for you don't learn just for hold on, why am I blanking? Yeah, you don't learn just by reading textbooks and stuff. Like you have to, just like a mechanic wouldn't learn just from books. Like they learn from apprenticing under higher mechanics. Right, shame on you for encouraging and training your replacements. Yeah, see, that's what we call a scarcity mentality, or, you know, now it's America Day. That's what we call a pussy mentality. And so what that means is now you're scared of, oh, this is going to happen, and I don't want to help people because I'm scared I'm going to lose my job. Well, you know, newsflash, my friend, you know, we're all teammates and we all work together. So I would rather work with my colleagues to be the best that we can be, to take care of patients, rather than being scared I'm going to lose my job. Because when you're scared like that, then like no one's going to want to work with you, and you're pretty much it's a loser mentality, quite frankly. Whereas winners, what they do, they realize they have to work together for the success of the mission. So if our goal is patient care, then rather than me just hoarding this information in my head, then it's better for me to disseminate it and speak it to people and teach it. And so NPs I've found have been the most willing to learn, quite frankly. I think a lot of physicians have just been arrogant. They're like, no, I don't need to learn any of this stuff. But I found NPs are very gracious and willing to learn. So that's why I'm like, okay, well, if I want to teach and they want to learn, why would I restrict that? Right. Like you literally see what I eat every day too. Strict dietary health, rich in vitamins and stuff. Yeah, because see, if you want to level up, then I mean that's the whole ethos of my, I guess, life philosophy. My practice is called Level Up Psychiatry. My NP coaching program is called Level Up Psych Academy, and the whole reason is because life's a game, and so to play the game well, you got to learn how to level up, and it makes life a lot more fun because it's like you're always trying to get better and better. And so, all the NPs in our program, they want to get better and better, and they actually want to learn psychiatry. So they join because they want to level up rather than have the arrogance of feeling like, oh, I know everything. Because most people don't know everything. I'm still learning. Like I'm a year. I've done residency, I've done fellowship, and I'm still learning. So if I'm still learning, then you know, it's arrogant to believe that you're not learning still. We're all learning. Yeah. So Robin, all the information is in. Just send me a message and I can send that to you, or you can just check it out in my bio too. Either way, but all the information's in there. Hey Ryan, good to see you, man. Hope you're doing well. Where are you now? Did you still in Alabama or somewhere else? I left after undergrad or med school. Sorry. It wants me to verify. TikTok wants me to verify my identity, but like I'm literally talking here. So, new psych NP started working 3 months ago. I had a psychiatrist. I had to practice. Love it. Nice. Yeah. Make sure that you're learning a lot and getting good feedback and mentorship. That's the most important thing. Because some of my students, they say that they have a collaborating psych or they work under a psych, but the psych just wants them to basically see patients all day without actually doing anything, without actually doing any teaching. Do you take new psych NPs? Yeah, we have a lot of new psych NPs in our program. And in fact, that's the best time to join is when you're new, because that's when you're the most hungry. That's the most wanting to soak up knowledge. And that's where you're probably going to struggle with confidence issues and imposter syndrome issues the worst. So if you want to avoid struggling with confidence, feeling like you're not good enough to treat patients, always second guessing all your clinical decisions, because I've had patients in my career where I've second guessed, like, oh, I should have done this or should I have done that? Should I have started this med or that med? Should I have really spoken to them in this manner or that manner? So I'll have those decisions all the time that I make. So you definitely want to, I forgot to turn off the oven. But yeah, having mentorship like that helps you so much. Nice, we're at 10K. Let's go. Hey, Levita, good to see you. No salmon for you today. No, we do have it. It's actually no broccoli for us today. I ran out, so today's more of a just straight protein kind of day. What state? I'm in New York. Then implement certain exercises and gain feedback to track progress. Exactly. That's how you learn. So the way you learn is like, okay, you read something, you try it, and then you get the feedback. Okay, this worked great, awesome. This did not work. Okay, what do I do now? And so that's where having a mentor is really helpful. Because then they can be like, okay, this didn't work for X or Y reason, instead of you figuring it out yourself. So now instead of you wasting 6 months to learn something, you learned it in a day, because a mentor literally just like caught that hole in your thing. So that's why we have, as psychiatrists, we go through residency, because we'll be like, okay, I think I should do this for the patient, and the attending will be like, no, you should do that. And so that's what I teach in the program as well too. So people will come to me with cases, and I'll be like, okay, I think that this is good, but maybe we should switch from this to this. What the ultimate goal is to encourage you to figure it out for yourself, and so that way you become a better and better provider. It's not for me to just tell you the answer, but you to develop the critical thinking to figure it out on your own. It looked like chicken. LOL. Yeah, it kind of tastes like it. Do you work with any PAs? So we do have a couple PAs in the program, but quite frankly, I've just found that PAs are less willing to seek out education. I think they feel more confident, I guess, or whatever in their education, and then MDs definitely don't. Like I think they just feel arrogant. But I just found that NPs feel very humbled to learn and are very like hungry for knowledge and seeking it out. So I felt that PAs don't feel like they need to learn as much psychiatry. So that's why I was like, okay, I'd rather focus on a group where I can really do the most help. But we do have a couple PAs in the program. You know, psych is the same whether you're a LOL, that paprika hit right in that wrong spot there. But yeah, I was saying, excuse me, I was saying that psych is still the same, whether you're an NP, a PA, or a psychiatrist. Like the material doesn't change, so it's about the learning. Just like if you're a personal trainer, like learning the gym stuff, fitness, versus learning it as a goer, like the material's still the same. Nice, we're at 10K likes. Let's go. Let's go. We are popping. Let's see if we can get to 12K. I think 12K is pretty reasonable for us to get to. Shouldn't be too hard. But let's see if we can get to 12K for sure. Today I might do 2. So see, today, since it's the 4th, I don't really have any plans right now. I think I was just gonna take it easy. Honestly, I was just gonna work on my program. I've been recording a whole bunch of lectures on lab modules, and so like different labs that you can do to like CBC, CMP, ANA, excuse me, cortisol. So I've been recording a whole bunch of lab modules, and basically I want to have a complete guide on what labs to order, and every lab you can order. Like I want a complete guide on that. So that's what I'm building right now for our program. So I think I'm just going to work on that. But my point was, like, let's say some plans come up in the evening. I'm thinking about like budgeting some calories for that, just in case. But typically I'll do about 1,500. Ooh, damn, 1,500 calories. No, 1,500 to 2,000, give or take. Yeah, or mentally I shoot for 1,500, but it ends up becoming 1,800. For me, my maintenance is about 1,800 to 2,000, but I'm trying to get a little bit. Oh my gosh, dude, that paprika. Okay. Yeah, but I'm trying to get leaner, basically like for summer, just for my own goals, so that's why. But so this is kind of like a slight cut diet. A maintenance diet is more like 20. $2,000, sorry. Lexapro in pregnancy. Yeah, I just got some water. Yeah, Lexapro is one of the safer ones in pregnancy. Lexapro and Zoloft. How much exercise? So I lift 3 days a week, and I do jump rope about 1 or 2 days a week. Yeah, so I just had a session today this morning, so I did that. No, I don't work with any insurance, but I do out of network billing for people. I did undergrad in biology, and then I went to med school after that. Can you go higher than 200 milligrams for Lamictal? You can. In neurology, for seizures, for example, they use 300 to 400 on Lamictal. I have about 50 clients I work with. I keep my practice small. Like, I'm not trying to grow it big. My goal is to my goal is to really work on my PMHNP program. Like, that's the most important thing to me right now. The practice is very second, because I can have more of an impact if I teach other people, and then they can help patients rather than just me seeing patients directly. Like, I can't really scale that as much. So that's a secondary. That's more of a secondary thing for me. Like, I still do it because it helps me stay sharp, and that way I can also learn cases and like I still stay on top of stuff, and then I can teach those cases I learn to my coaching program for my students. So I do a lot of case recordings, like case studies, basically. Like, okay, I saw this case, like this is how I broke it down, this is how I treated it. And I'm doing a lot of integrative cases as well. So I do a lot of functional medicine, supplements, all of that. So that's something I teach as well in the program too, how to do that. Oh, okay, Lobsterkin, you are I couldn't tell what you were, like if you're asking from a patient perspective or a provider perspective. Okay, so this will be a good time to ask. Yeah, so who here is a provider, and say what kind of provider you are, and then who here is a patient? Like say one if you're a provider and two if you're a patient, because that'll allow me to determine like what level of detail and stuff to answer questions. And then what kind of provider? Dr. Slater says 1. Bianca says 1. Steen Ballerina says 1, 2. Sweet Tawny 2. Manic Pixie Life Coaching, provider, life coach. What kind of provider? Okay, stops citalopram. I'm a psychiatrist, but I teach psych nurse practitioners. Bianca says NP, was in family med, now in ID. Interesting. I'm a patient, but I'm here for a provider perspective. I'm pre-med. Oh, you're pre-med doing research. Okay, yeah, then I want to be worrying about like matching and stuff. I forgot to put some lemon on it. Damn. DNP, FNP, internal med, nice. Mary Jane. No, we're hanging out together. See, the whole point of food, Mary Jane, is, I mean, obviously it's to sustain yourself, but it's also to bond with people. Like, that's why people eat together. That's why dinners and stuff, and, you know, it's such a ritual. So now, you know, instead of me eating here by myself, now we get to eat together. And like I said, we're literally, so you should get some food too and eat. How do you feel about using ketamine? Yeah, so I've never used it personally, but I have referred patients for it. I use it for treatment resistant cases. So let's say they've tried a couple stuff, it hasn't worked, that's when I'll refer people to it. And in fact, we're actually having a lecture in our coaching program on Tuesday on esketamine or Spravato. One of the representatives is coming to speak to us on that, so that way we can learn more about it from the source too, because that's something I'm including into the program as well, is external speakers who know or more knowledgeable about stuff that I am, and that way they can come and teach us too, because I want to have the best education for our program. No, I did it in the oven. No, not sales reps, MSLs. So they're more like pharmacists and PAs who work with the companies and they educate us. So that's the difference. It's not that they're selling us on it, but rather they're showing us the clinical studies. So it's educational for us. Thank you, Lobster King. I appreciate that. Thank you for the double taps. We're almost at 15K likes. Let's go. Nice, 14 point. Thank you, Bianca Swifty. Appreciate it. Appreciate that. Protein plus carbs. Yes, any day of the day, week, month. Protein will always beat out carbs. Because remember that protein can actually become carbs in the body, but carbs can never become protein in the body. Where'd you do residency? I did in Western Michigan. Western Michigan University. That's where I did my psych residency. Now we're at 15. We're at 15.4K. Let's see if we can get to 20K. Let's see if we can get to 20K likes. We're at 15.4. Where am I based off? Guess. Is this does it give you a cue? I start med school in the fall. Yeah. Make sure that you prioritize your diet, your sleep, and your exercise, so that way your brain will be the optimal to function and absorb information. Don't fall into this trap of what your students will do, which is what your co-students will do, which is like studying late at night and binge eating, or like eating snacks all day and doing all-nighters. Okay, sure, your grades might be better, but you will suffer way more and you'll feel like it's miserable, as opposed to getting through med school and enjoying the experience. I graduated in 2019. That's when I graduated med school. What's good for acid reflux, GERD anxiety? I mean, probably treating the GERD. Yeah. What's the hardest mental illness to treat? In my opinion, I think it's addiction. I think it's the hardest one. Because it's really hard to help someone who, I mean, there's not much medication for it. I mean, that's for one. It's like, it's really hard to help someone who's like caught into those negative thought loops and like doesn't want to take the actual steps to change things. Would you recommend start preparing my med school classes during the summer? No. Enjoy your summer. Like I caught up on so many video games during that summer. Like I played Ocarina of Time for the first time. That's the main one that stands out. I think I played Borderlands too. Yeah, it was a great summer. No regrets. Yeah, you'll have plenty of time to study, and you'll forget it all anyway. Okay, I'll see you later, Lavita. See you on Monday for sure during our Q&A call. Today was a protein day. Protein and fats over carbs any day. Because protein will fuel your muscles and give you the building blocks. Fats will provide the hormones and the testosterone needed to build. So both. Carbs are very overrated, and they're a poor source of energy because they fluctuate up and down. I got a call, so I just need to respond to the text. Okay, yeah. So I was just catching up on stuff. So, see, it's so funny. Like I literally just ate. Like you saw this. I just ate, and one of my friends texted me. She's like, "Hey, I'm in the city, doing some stuff. Hey, you want to go grab food?" I'm like, oh my gosh, you know. So, whatever. Oh well. Yeah, exactly. Oh well. You know, shit happens, right? And see that's what I was saying earlier. That like, you know, I'll eat, but then I'll like to save my calories, quote unquote, for later, just in case. Yeah. SSRIs and NRIs, which are the most prescribed for Parkinson's patients. More SSRIs, I think. Nice poll. Thank you. Psych industry, BPD. Most dislikes like Most disliked diagnosis when they come to the hospital. Yeah, I mean, BPD is one of the ones for sure in the hospital. A lot of people don't like that. Stigmatized, yeah. Yeah, because it's like a behavioral thing sometimes too, and then like the person will really come at people personally. I mean, what people say to me personally, like I don't really care, but like other colleagues get affected, then it affects my work. Pharmacy is a dying profession. Yeah, yeah, especially in the modern day stuff. The modern day, like it's just you have to remember that every job, the whole point of a job, from the employer's perspective, is to get as much value or production out of you while paying the least, right? Like that's how the business or the venture makes profit. So for pharmacists, you make good profit by utilizing the work to the max, like CVS and Walgreens and like that. I work in a psych hospital with NPs. As a psychiatrist, you have the ability to designate as SMI. Yes, yes, yeah. Severe mental illness. Yeah, generally schizophrenia. Regional pharmacy manager. Yeah, exactly. Yeah, I think that's how you level up. A lot of the pharmacists I've seen, or now recently, I've seen that they become MSLs. So they'll work with the various companies in the industry, and use their expertise and knowledge that way. So that's what I've seen, and I think that makes a lot of sense. Damn, damn! I literally just ate. Okay, I'm gonna look up. Actually, I have a separate phone.